Thursday, May the 19th. We are joined today by our CEO, Nicole Dupuis, and our Acting Medical Officer of Health, Dr. Shankar Nessathuri. We are going to begin today's sessions with some opening comments from Dr. Nessathuri. Please go ahead.
Colleagues, members of the media, thank you for allowing us to speak today and share our perspective. I wanted to spend a little time today having dialogue about what's commonly referred to as Long-Covet. At the onset, Long-Covet as a phenomenon requires more research and greater understanding, but I wanted to share a few comments with you today. I'll start by talking about the formal definition, which is what the World Health Organization articulates, and I'm going to quote them. Post-COVID-19 conditions occur in individuals with a history of probable or confirmed SARS-CoV-2 infection, usually 3 months from the onset of COVID-19, with symptoms that last for at least 2 months and cannot be explained by an alternate diagnosis. Common symptoms include fatigue, shortness of breath, cognitive dysfunction, but also others, and generally have an impact on everyday functioning. Symptoms may be new onset following initial recovery from a COVID-19 episode or persist from the initial illness. Symptoms may fluctuate or relapse over time. So that's the formal definition, or a formal definition. And I think as we move forward with COVID, that we'll probably modify that definition or come to even additional understanding about what Long-Covet is. So maybe more informally, I could comment, what exactly is Long-Covet? Well, it's when people have a COVID-19 infection and the symptoms of that COVID infection don't resolve after some period of time. Normally, when you have a respiratory infection, you expect over a period of weeks that you'll get back to where you were before. But for some people, their symptoms will persist onward. Some people who have Long-Covet had pre-existing or prior to the underlying infection medical problems. And after the COVID infection, those medical problems may be exacerbated and persist. There's some contention about this, that it's possible also that after a COVID infection that you may ultimately develop a new disease or new symptoms after a period of resolution, meaning this: you got COVID-19, you had a cough, you had a shortness of breath, you had a fever, you got better, and maybe sometime later you developed a new illness. I think we have to understand that just a little bit more. I think it's worth commenting on what are the most common symptoms. Most common symptoms are fatigue. Colloquially, people talk about brain fog, but basically they're difficulties with cognitive function, difficulty concentrating, difficulty focusing. Some people with Long-Covet have muscle aches, headaches, weakness, diarrhea. Some people have a persistent and elevated heart rate. How common is Long-Covet? Well, the answer to that is we're not sure, or I don't think there's a clear consensus on this. People who have a more severe course of COVID are more likely to have persistent symptoms, meaning this, that if you went to the ICU or went on a ventilator, when you are discharged from the hospital, you're more likely to have Long-Covet symptoms than someone who didn't go to the ICU. But perhaps people with milder infections, 5 to maybe even 30%, will have some component of long-lasting symptoms. There was a recent paper in the Nature journal which indicated that people who develop COVID, some of them have structural or pathology in their brain, or they have abnormalities in their brain that are documented by the MRI machine. One question people might ask is, why do some people have persistent symptoms? And again, there are theoretical, there are theories. One is that the virus is, in people that have long-lasting COVID or long COVID symptoms, there's persistent virus in the body. So the body has not eradicated all the virus. It could also be an autoimmune response, meaning that although the virus may be eradicated, the body's own immune system is activated and turning on the normal tissues and normal cells. And there's another theory that perhaps when you get COVID, other viruses that are dormant in your body are reactivated. So how does one manage long COVID symptoms? Well, I think the first thing to think about is that it's managed by family physicians and nurse practitioners and specialists. When there is a symptom related to a particular organ system, the right specialist should be consulted. I think there's also a role for comprehensive or multidisciplinary programs to treat long COVID. I think that that's an area of real opportunity for this province to try to address that from a health services point of view. But why is this important from a public health perspective? Well, the Public Health Service is clearly interested in making sure sick people get help and get healthy, and articulating that people who are sick also need services, medical services and other supportive services. But there's also the broad implication is that we may be dealing here with a parallel pandemic. So we have the pandemic of people getting COVID and trying to minimize the burden of COVID. And then we have the parallel pandemic of people that have long-acting symptoms or long-lasting symptoms who need help. And that help will require additional resources. And what we really want, and this is the key goal of the Public Health Service, we really want all people to fully participate in society, in their jobs as employees, in their families, and in their volunteer and social commitments. And as long as we have a group of people that are not able to participate, we've not met all of our public health goals. Thank you, and we're happy to answer any questions.
Thank you. We will move into our first round of questions with 2 questions per media outlet. We will start with CTV.
Good morning. How much do you think the burden of disease has to decrease before COVID isn't a concern anymore?
Well, I think that we're going to have to learn to live with COVID with its fluctuations up and down. We're going to have periods of decreased activity and periods of increased activity. I think we can try to live a more normal or more learn to incorporate COVID-19 as a disease that we have to manage as a society. I'm not sure I could give you a threshold number, because that threshold number is also modulated by hospital resources, the different variants that we might have, access to antiviral drugs and vaccination rates. I think if we best want to live with COVID, if my recommendation would be, we have certain levers which we have not pulled fully, and one of them is to get our vaccination rates up. Yeah, you know, it's thought that if you're vaccinated, you're less likely to suffer from long COVID symptoms. If you're vaccinated, you're less likely to get seriously ill from COVID-19. And I think that getting our vaccination rates up is important. I think as a culture, we have to have a plan to vaccinate people with booster injections on a regular basis. We need to have enhanced and robust access to antivirals. And periods of increased disease activity, we're going to have enhanced public health measures, including wearing a mask indoors. So I think that's the framework that I would try moving forward. I wish I could give you a summary answer, but unfortunately, it's a little bit more nuanced.
Thank you. And what would it take for the World Health Organization to declare it an endemic, and when do you anticipate that could happen?
Yeah, that's a question for the World Health Organization, and they'd have to make those decisions. I think at some level we all recognize, I don't think there's a bright line between epidemic and endemic. I think most people recognize that COVID is here to stay, and to that extent, there is a component of endemicity to it. But I think the questions related to the World Health Organization determinations have to be best responded to by them.
Okay, thank you.
And we'll move on to questions from CBC.
Yes, good morning. Anything about the data highlights that's standing out to you this week?
Well, I think that when we look at the data overall, there's some indicators that suggest decreased disease activity and some indicators that suggest maybe a more static level of disease activity. I think we have to look at the data elements overall and, the number of cases and recognize the limitations of how that data is collected. But my guess, an overall assessment of this, and which would be cautious, is disease activity is about the same this week as it was the last time that we met. Maybe perhaps a little improved.
Thank you.
Any questions from Blackburn?
Not really, no. I think I wanted to ask a bit about Long-Covet, but I haven't formulated the question, so I'd move on.
Okay, thank you. Any questions from the Windsor Star?
Doctor, do you have any idea how many cases of Long-Covet there are locally?
I don't think we have, I'm not aware of any local data quantifying the number of people who have Long-Covet. The estimates on a population health level are so variable, but we don't have any local specific data. If you sent us an email, perhaps we can have someone on the EPI team research that question for you. But I don't think we have any local data on that item.
And going on a tangent, do you anticipate eligibility for fourth doses expanding anytime soon?
We're always cautious about trying to predict the future and predicting provincial policy. As a clinical matter, I would anticipate that at some point that there will be expanded availability of additional doses. I think the strategy moving forward is to have episodic revaccination or booster vaccination of individuals. That's consistent with other strategies in public health, like the flu vaccine, which we vaccinate every year. And so I would anticipate that's the direction we'll be moving in, but the timing of it and the provincial policy is something that provincial officials would have to comment on.
Okay, thank you.
Any questions from AM 800?
Doctor, just sticking with the vaccines, the 52% for residents 12 and over for 3 doses, is that low for you? Obviously, you want to see that higher. Are you concerned that that number hasn't really increased over the past few weeks and maybe even months? Are you concerned that that number for 3rd doses hasn't really moved?
Yeah, we're very concerned. I'm very concerned. COVID has killed, I think the last number I looked at, I think it's killed approximately 620 people in the health district. Many of those people were living in the community, and if they didn't have the COVID infection, they would be alive with us today. We know that the vaccine prevents the most serious consequences of COVID, which is hospitalization and death. And we also know that the vaccine wanes in benefit as you have 4, 5, 6 months from your last injection. Given the fact that only about half of people in that age group are vaccinated, I worry that we may have a resurgence or increase in cases, and an increase in hospitalizations, and an increase in death. We also have to think that there are likely going to be new variants of COVID, and that may affect the burden of illness. So, we can learn to live with COVID, but if we're going to learn to live with COVID, we all have to do things differently to try to mitigate the risk to our community.
And Nicole, for you, just in regards to the vaccines and the pop-up clinics, how's the response been? I know the promotions out there on social media, on your website, the dates that these clinics are happening. Is the health unit seeing the crowds still, or are they very, limited?
Yeah, I don't have the exact numbers, but I would say we're not seeing crowds. We are still seeing individuals. We are still vaccinating, but it is a much more, it's a much slower uptake. And I think you're seeing that in the numbers. It's a bit more of a crawl right now. And so certainly we would like to see that, especially knowing that we only are at 50% for third doses. So we'd certainly like to see more people coming out to be vaccinated. We definitely have a lot of vaccine locally available. So we also want to make sure that we get that vaccine we have on hand out and in people's arms so that they can be best protected, and we continue, to have the static disease state we have.
Thank you.
We'll move into our follow-up round of questions, limiting it to one question per outlet, please, starting with CTV.
Yes. Were you surprised the masking request for indoor settings was rejected by the province?
Yeah, we try to work with the province to give the best guidance that we can, and I'm hopeful that the province will consider the recommendations of in trying to formulate the best plan for managing COVID.
Okay, thank you.
Follow-up question from CBC.
So the province did respond to the initial letter from yourself and the two other medical officers of health?
They did. The province did respond, and they did share their perspective related to the request by myself and the medical officer of health for Peterborough and for Niagara. I hope that I hope that our continuing dialogue will be helpful as we move forward. I think that even with the current burden of disease, I think that there is a role for wearing masks indoors or in times when one can't stay consistently 2 meters away from another person. I think that we have to recognize that as one incremental benefit in trying to manage the burden of COVID-19, but looking at the risk versus the benefits, I think is the right approach.
Thank you. Any questions from Blackburn?
Yes, now that the province has rejected that option, are you still holding firm that there should be no local mandate, that it has to still come from the province? I'm just wondering if a local mandate is better than nothing.
Well, at this point, I think that provincial action would be the most appropriate item. At this point, we're not contemplating any local order requiring masks, but we make a strong recommendation for people to do that, and I hope that people will heed that advice. It's difficult to predict the future, and every option remains available to the health district. But I think an item like a masking mandate is best achieved at a provincial level.
Thank you.
Follow-up question from the Windsor Star.
Nothing further. Thank you.
And AM 800.
No, thank you. Have a great day, everyone.
All right. Thank you all very much for joining us today. Our next scheduled media briefing will take place on Thursday, June the 2nd. Have a wonderful day.
All right.
Thanks, you too.
All the best.
Thank you.